One of the many things VLF management team did well was the training of their staff to prepare them for the new system. VLF implemented a learning-based strategy to ensure end users' adoption of the system, which offered special training sessions based on different functionalities of the new system. HR at VLF also recruited 8 GPs with interest and understanding of IT, which proved to be a success in the delivery of a new system. These new recruits also help train other staff members and doctors on how to effectively use the system. All VLF directors visited the hospital on the day the system was implemented in order to provide unconditional support for the staff struggling to use the new system.
So to follow on from what Alex has said about what the VLF management team did well, was management transferred staff whose jobs were going to become obsolete into different areas of the hospital so that they could still work in the same place. For example, the head of inpatient registration and archives stated for the dictaphone secretaries it was clear that their jobs would disappear when the doctors began typing clinical notes themselves. We assured them that since the demand for services kept growing, most of them would be assigned to different units, and this is exactly what ended up happening. So once management had realized that the implementation of SAP would greatly reduce the jobs needed in certain areas and even make certain jobs obsolete, they worked out that the way to shift people around and keep as many employees as possible, which in most situations would not even be considered. To help with these changes, they created training groups and sessions that took employees whose roles would be shifting and gave them extra attention to make sure that they both understood what was going to be happening to their current role and what their new role would entail, along with providing top-of-the-line quality training to make the transition as seamless as possible.
VLF in general had a fairly successful implementation of their SAP. However, in terms of what they could have done differently, the decision by management to choose a big bang rollout approach wasn't necessarily the most appropriate considering the circumstances. VLF reported their help desk being overloaded with issues due to the use of a big bang rollout approach and later admitted that a phase approach would have been more appropriate. The issues identified with the phase approach was the need for the development of interfaces to maintain parallel systems. However, due to VLF using the pen and paper method for recording almost all of their data, these interfaces would have been cheap and simple to implement. The benefits far outweighed the negatives, and this approach would have allowed staff to be able to slowly adapt to the new system. The help desk would also not be overrun with issues because there would be far less new features for staff to learn at one time. VLF highlighted the issue of resistance to change early in the implementation process. In order to stick to their earlier developed blueprint, a phased approach should have been chosen. In saying this, the implementation as a whole by VLF was very successful, and while being more time-consuming, their chosen approach was still effective.
Could VLF's change management strategy be used in another hospital or industry? The type of conversion needed to transform business processes through an information system relies heavily on the constraints and environment the business is placed in. VLF aimed to integrate all core business procedures within the hospital, which made the characteristics of this implementation different to other businesses. There are certain features within SAP implementation that remain constant regardless of the organization it is used within. Part of the implementation process is to minimize the resistance to change and enable the employee to adapt to the new software. VLF attempted to achieve a smoother rollout of the software by installing training labs in their hospital with SAP modules for staff to complete at any time. Furthermore, they also offered taught training sessions to help staff learn all aspects of new functionality. This in-depth training procedure was vital in the implementation of SAP within the hospital and assisted staff in better understanding of the software. This level of training was required for the extreme circumstances within the hospital environment.
Following on from what Reese mentioned on VLF's change management strategy, their main focus during the implementation of SAP was the staff and ensuring the adoption of the system. As long as other hospitals make training one of their key crucial aspects during implementation, they too should have a successful transition. Take for instance the VLF assistive personnel, which accounted for 58% of VLF employees, where 60% of these assistive personnel were lower skilled. With such diversity of IT system knowledge, VLF still were able to effectively implement SAP, and so this too shows how VLF's change management strategy could also be used in another hospital. In terms of use in other industries, using VLF's strategy should be easily applicable as a hospital is a 24-hour environment that needs constant attention, and even VLF were able to work around delaying productivity. This was done through a big bang approach, and so the hospital did well in implementing contingency plans throughout the hospital to avoid delaying critical patient care.